obviously we've had the press release come out that the restrictions that we currently have in place in the Falklands are going to be lifting from the 4th of May. The first question really is, why lift restrictions now?
I think, why now? Why not now? I think we were just chatting about this before we started. I think it's really important that we pick an optimum time when we think it's about the safest time we can do it. It would be lovely, wouldn't it, to stay in the Falklands and have nobody come and go until COVID's disappeared and is a thing of the past and never exists. That's not going to happen. So we have to find a way to move forward in a safe way at a safe time. Everybody's vaccinated. We've got some good medicines that we can use for the people who may become unwell and need hospitalisation. And we've been able to follow models from around the world looking at how vaccine has impacted hospitalisation rates. So now is about as good a time as any to do it while we're all vaccinated and we've got good response to the vaccines, and the vaccines haven't waned in their response yet. And COVID might come in. So if we catch COVID now, that's okay. Our natural immunity will also kick in and cover us. Why are we waiting till the 4th of May? It's because we have a few bits of in-house work to get organised before we're ready to go, and that includes getting staff, drugs, and all the private businesses and government business getting organised with their business continuity plans too.
And I know in the Exco paper there were 3 different options that were being considered. Why is the option we're taking option A, the one that was recommended?
I think it's a good question because could we have stepped down in an even more gentle way? And that's difficult. We were already on a 5-day test to release for fully vaccinated people, and that's worked really well for us. I think we've been right close enough to not obstructing people's liberty any more than we need to, but containing COVID and keeping it in quarantine and not in the general community. Had we gone to a test on arrival, a mandated test on arrival, ultimately wouldn't have made any difference to our public health risk moving forward. We will see COVID come in on a 1-day test to arrive process. So I think actually testing people or encouraging people to test themselves once they arrive here is probably the safest way forward to try and contain and control the spread of the disease. Having a mandated test on arrival isn't actually going to make much difference to the public health consequences.
Because I know when we spoke to you and Tom a few weeks ago, we sort of mentioned that test on arrival is something that would be considered to be put in place before restrictions were lifted. And now obviously you're saying that's not an option. So why sort of the move away from that?
It does remain an option, and Tom might want to talk a bit more about this in a minute. It does remain an option, but when you look at it on balance from a public health point of view, it doesn't actually provide much difference. Also logistically, it could be a challenge to implement. It would delay the processing of people at MPA. That's not a reason not to do it. We should only do something if it's going to have a significant public health impact.
And I think that's the difference, and that's why, and with further consideration, we've kind of moved away from looking at that test on arrival or a regime where there's an enforced test on arrival, because actually it made little difference in terms of whether or not COVID would there would be community transmission of COVID. So kind of, with that reflection, it just seemed like, well, why would we do it, and why would we put people through it?
I think it's important just to add that you asked why option A, and I think all the way through COVID from the very start we've listened to the best advice that we have from officers here and abroad. So when we're being told that this is the way forward, of course we question them regularly and push to for that evidence to be supplied, and it is, and it points clearly to option A. I think anything else would have been just sort of trying to fudge it out for longer, or to put it off for when the science is pointing that we should be doing this.
And I think finally all I would add is, so that people are aware that it's not just being removed all of a sudden, additional sort of safety nets that we've put in place. We've seen the day 2 testing work really well. So on arrival, you will be given a self-test to do on around day 2, and that will be on advice for you to do in your own time. So that mechanism, that safety net will continue to be there. And on top of that, we're also going to ensure that all the right pharmaceuticals are in place as well, should anyone else get poorly later on down the line.
So you mentioned they're giving people their own lateral flow test to do at home then after they have arrived. Yeah. Is this an optional thing to do, or are we just sort of relying that people will choose to do this but they don't have to do this?
absolutely, moving forward, it's going to be an optional thing. We hope that people will be encouraged to self-test. That's going to be a hallmark of moving forward for people, not just new arrivals, but actually all of us once we see COVID in our community. It's going to be important that we all pay attention and swab regularly to try and contain the spread, and ultimately to try and contain the spread from the at-risk people.
And so is any, because I know obviously for the past 2 years there has been the coronavirus legislation in place and these restrictions in place. What changes to the legislation are actually happening when the restrictions are lifted? Will there be anything in place to make people, if they're positive with COVID, they have to isolate, or they will have to do surveillance swabbing? Will there be anything like that legally in place?
Well, it's intended that over the next few days that we put regulations in place which, when put into effect, would allow the chief medical officer to direct someone for screening and assessment, and gives medical officers the power to impose requirements and restrictions on individuals, including the power to direct someone to remain at home or at a specified place. These powers were originally put in place in 2020 and were used prior to the blanket quarantine requirements that were then put in place afterwards. So there still will be powers, but to direct an individual rather than to direct the whole community.
So it's something that, because I know it says that if you're in a house with someone who is tested positive, you'll still be free to go out and about, but will the person who tested positive, will they be asked to self-isolate?
We will advise people to self-isolate. We've seen throughout this whole pandemic that everybody's just been asked to self-isolate. Self-isolation has never been a mandated process, but people have followed our advice and they've behaved well. I mean, it's been striking to me how cooperative people have been and how willing they are, because nobody wants to be the person that spreads the disease and causes problems, and I anticipate that will continue. But this will not be mandated. People will still be advised. If we see particular individuals behaving in a particularly risky way, we do still have those powers to ask people to isolate, but I hope we won't have to use them, because as yet we've never had to use them in the last 2 years.
That's really positive news, and obviously so far everybody has been following the guidance. And so will there be routine swabbing systems in place where people are sort of encouraged to test and swab just throughout the community, even if they don't have symptoms?
So what we are going to do is make sure that LFD tests are readily available to everyone, and that's not just those based in Stanley. We're going to make sure they're placed out in camp as well up at NPC, so everyone has got as free access to those test kits as they so wish. We'll encourage people, if they think there might be a reason they've been in contact with someone that is positive, by all means take a test. Similarly, if you have no reason to believe but you are feeling unwell, by all means take a test, and we'll make it readily available.
So how many lateral flow devices are being sort of planned to be brought in? Because I know in the EXCO paper it mentioned that for option A it suggested 15,000 lateral flow tests. That doesn't seem like an awful lot of tests as we're sort of moving through this, if people are sort of having to test like every day, do daily tests, things like that. So how many realistically do you think we're going to need?
So the 15,000 in the EXCO paper, and you're correct, that's what was written. That's on top of what we were already doing. So the 15,000 on top of what we were already doing for the day 2 and the day 5 or 8, depending on if you were a new arrival. So in total, we're expecting to churn through sort of 25,000 plus tests. And we're seeing already that the stocks and the resupply is pretty robust. And if we do need more, although we're not anticipating so, we believe we can get hold of some fairly quickly.
So obviously the medical procedures that we have in place, we saw at the start of the pandemic, there was the Operation Nightingale to show that we have those procedures in place, and there's obviously an issue with sort of how many intensive care beds we have down here. Will lifting restrictions all at once, does it have the possibility that it could overwhelm systems in the KMH or in other places?
We're not anticipating for that to happen, because we've seen from around the world that a highly vaccinated population means that it does not mean that you won't catch COVID. It doesn't mean that we all won't feel a bit rotten with COVID and feel quite unwell, but it is much more likely that we are going to avoid hospitalisations, and it's very unlikely that we'll see any deaths. Can't promise that, just like any flu, any viral illness. And if you remember right at the beginning of this pandemic, we had somebody who was in intensive care and was very unwell, and that wasn't COVID, but they were still very unwell. So we're not anticipating that relaxing the regulations and relaxing the border controls is going to see an increase in hospitalisations. We wouldn't be doing it if that's what we thought.
And obviously we've got some quite big events coming up in the next few months, one of them being Liberation Day and the Liberation Day commemorations. With the quarantines lifting, it means obviously the availability of people being able to get to the islands to celebrate and commemorate for Liberation Day is quite high. Could this be a super spreader event? And if so, what measures will be put in place to protect the community on Liberation Day?
There's always going to be some potential super spreader events, if that's what you want to call them. I think it's really important that we've mentioned from the beginning of COVID that it is very likely COVID will get here eventually, and once it does, it's likely to spread quickly. All I would suggest is with any of these big events coming up, if you're feeling unwell, stay at home. If you are going to a crowded event like the Town Hall on Liberation Day, maybe that's a good day to do your test on, to do your self-test, just to check that you're not somebody who's got COVID but has no symptoms. And so that I would be advising people to test regularly prior to big events like that. It just makes sense to me. People can do it or they cannot do it. We're not going to be there policing it. We will release some clear guidance. In fact, I've been working on that so that there will be a clear outline of the advice that we're giving people. It is not mandated, it is merely advice. So yes, of course we're concerned that we might see a spike after something like the Liberation Day events. But if everybody behaves well, tries to socially distance, is very careful with their hand hygiene and their cough hygiene, uses hand sanitizer regularly, and ideally self-tests on the day, then I think there's no reason why we shouldn't be able to keep control of it all.
I think that something that's already been emphasised is that the community of the Falkland Islands have responded really well so far to the things that have been asked of them. Not things that have been regulated, but things that have been asked of them. And we think that our community will continue to respond in that way. We really do.
And another big event that is happening in children's lives in the Falklands is the GCSEs that are coming up. I know parents have expressed concerns that the restrictions being lifted right as GCSEs are starting, it could cause stress to students, and obviously they could face potential disruption if staff are off sick or if they're off sick. Is it fair that pupils' GCSEs might be disrupted for the sake of lifting restrictions a month beforehand? We
think it's really, really important that our students are given the best chance of success with their GCSEs. And one of the big reasons why we wanted time to plan for the easing of this restriction is so that we can do things like put things in place within our school to enable those exams to happen and to try and enable them to happen in an uninterrupted way. I think it's really important that throughout the next 4 to 6 weeks or so that we communicate regularly and closely with parents, with staff and with the students themselves so that they can check on how we're doing in terms of putting those plans in place.
What sort of plans will be in place to sort of help mitigate disruption?
Well, we're talking with the Director of Education, with the Executive Head at the moment, but they are currently working through those plans. So I think for me to try and second guess their work would probably be wrong at this stage. What
you did mention though is stress, and it's not just stress for GCSEs. It's going to be potentially a very stressful time for everyone who may be apprehensive. So the Directorate of Health and Social Services will be upping our sort of resilience in terms of mental health provision, as well as making sure that social services as well are there for those people who need that extra little bit of support over this period of time.
And I know, going back to what you said there, Andy, about you sort of can't preempt what the Education Department might say about plans in place, but I'm assuming will this also cover contingency plans if students have tested positive right before an exam?
Yeah, no, absolutely. They'll be looking at those contingencies as well as things that they might wish to put in place in terms of the sort of the mainstream services within education. I think it's really, really important that we listen to the professionals within their areas, and that actually they inform us about the things that they need to put in place, rather than us trying to mandate something from the Secretariat that might not work for every single service. It's really important we listen to the professionals.
And do you think the schools have been given enough time to prepare? The exams obviously start on the 4th of May, the same day as the restrictions ease. Is sort of this month going to be enough for them to sort of come up with these mitigation plans?
We've been working on business continuity arrangements within FIG for some time. So this is not business continuity planning. It is not something new, and is not something that will come as a surprise, I don't think, to our teachers and our staff in the education department.
And then obviously with the average, at the moment we've seen a schedule where we've got the clean and the dirty flights coming down. With the no need to quarantine here, will this continue, or will it go back to sort of 2 flights a week that civilians can get on the average?
So we have had discussions with CBF and MOD, and we'll continue to do so. Exactly what the arrangements are at the moment, I think that still needs to be worked out. It's, we will constantly continue to sort of push on this and find out exactly what's happening in terms of the mitigations there.
And I know obviously it says that the Falkland Islands, it will no longer be a requirement of the Falkland Islands government to have a negative test before arriving here, but it might still be a condition of travelling through Dakar. Is there any likelihood that might change, or is that completely out of FIG's hands?
In the short term, I believe it's certainly going to carry on. The MOD are going to require pre-flight testing, and so that will continue for the short term, but we're not sure how long at the moment. That will be subject to MOD.
And talking about air links, obviously it's a question that everybody's been asking for several months. Is there any update now then on the LATAM flights restarting?
Absolutely. So we've been talking to our partners overseas in South America and looking at how we restart these flights. It's expected that we'll be looking to start the Chile flight early in July. So that's the date we're working to at the moment. It takes some time to set these things up. It can't happen instantly, and we've got to sort out our arrangements here as well. It's going to be subject to international travel restrictions that may arise. So that's the date we're working to, and hopefully we can. I think it's the 2nd of July will be the first Saturday then. It's envisaged that we'll get the Chile flight up and running first, and then work on the Brazil flight shortly afterwards.
Just to reinforce what Mark has said, LATAM have for some months now insisted that they will need 3 months to remobilise themselves. So we're working to their timetable really, but in order to start that remobilisation period, they said that they would require from FIG a decision around quarantining. So by delivering the decision, the 3 months of remobilisation can start now, which I think is really good news.
Yeah, I suppose that makes the international connectivity a lot easier than for people, and they're able to travel back home to South America.
I think it's been unfortunate that we've tried to put on compassionate flights in recent times, and they've been cancelled for reasons known to others. But I think it's really unfortunate we've not been able to do that. But hopefully this will come to some comfort from those within South America, realising that the regular scheduled service will be starting up very soon, I hope.
Coming back to sort of what's happening then in the community, I know that in the Exco paper, in your forward to it, Becky, you said that there was little justification in keeping restrictions in place from a public health point of view, but it could still happen, as with any respiratory illness, that deaths may happen. If there is a large outbreak of COVID in the community, if we do see deaths in the community, will lockdowns be considered?
So I think the key thing to take away first of all is a lockdown is a very extreme measure and is a worst case scenario. We have seen it. Many countries across the world are implementing a lockdown right now as a response. We are in a very different position whereby we have a small population and a highly vaccinated one at that. So the good thing is that we have that in our favour. What we also have is the Exco paper that's currently out on circulation for everyone to see. They will notice one of the appendices is redacted. The reason that's redacted is not for secrecy. It's a document that is in draft at the moment, which will be a public-facing document once it's finalised, hopefully very soon. And that would outline exactly what our response might look like, taking into account not only hospitalisations and how many cases that we have, because that will no longer be the overwhelming drive for us to make sure that we are responding in a particular manner. It's going to be how can we best look after people should they require hospitalisation and the capacity of the hospital in particular, but also other critical national infrastructure.
And obviously we've spoken about the capacity of the hospital, and if the hospital is able to cope, it's probably going to be a very morbid question, but if we do see a large number of deaths, which hopefully would not happen, are services such as the morgue in a position to deal with this?
We're absolutely, we would not be relaxing the border controls if we thought we were going to be overwhelmed with COVID-related deaths. I think it's really important to stress that. The reason we've chosen this point is because we're in a strong position from a public health point of view with good vaccination. We've got excellent coverage across our country. That's not to say that those few individuals who've chosen not to be vaccinated shouldn't still come in. We'd love it if they could come in and get vaccinated. It's really, really important because we don't really want to have any weak links in our chain when it comes to protecting us from COVID. But I think that's not going to be an issue. I am very confident saying that. I would never make a promise. It would be ridiculous to say I can guarantee, we're not going to see deaths. I'm not guaranteeing we won't see deaths, but I am very confident we will not see lots of deaths as a result of COVID-19.
And obviously you mentioned vaccination there. I know that we've spoken a lot in the past about vaccination numbers, and I've seen the vaccination programme between the 5 to 11-year-olds seems to have gone quite well as well.
Brilliantly, yeah. We've got a few kids left to mop up. We're going out to camp tomorrow on Tuesday to do some more vaccination in camp, to provide some more booster doses to adults and some children's doses out there. So yeah, it continues and it will continue. We will continue to provide vaccination as and when we're directed to by the JCVI and the UK government.
And so obviously this does represent a big step forward in the Falklands response to COVID. As a community, we've been very well protected for the last few years. I know you mentioned vaccination status there, and obviously how we're not envisaging a situation where there could be lots of deaths. What is the main thing that needs to be done then to keep the community as safe as they possibly can be?
For me, and everybody might want to comment in individually, but for me it's going back to the very, very basics. So social distancing, opening doors and windows if you're all together in an enclosed space, washing your hands, sneezing politely into your elbow, into tissue, throwing tissue in, washing your hands. Those very, very, very basic things matter. They make a big difference. Staying away from others if you feel unwell. Please wait, contact the hospital, don't just go out. We can arrange a test for you. The information around this will be shared in the coming weeks about exactly how we're going to deliver this resilient package of swabbing to the community, and also surveillance swabbing, individual surveillance swabbing. We've touched on it already. Tests will be free, they will be plentiful. We will be encouraging people to test regularly. That's what we need to do. That's how we can try and control the spread through our community. Hopefully we won't have a fast burn, but a slow embers of COVID fire creeping through our community. And if we all behave responsibly, I can see no reason why we can't get through this and out the other side.
I'd just like to say that I think all through this the last couple of years that we've been dealing with COVID, I think the advice has been fantastic from Becky and the team at the hospital and government more widely. But I just urge people to look for the advice, to follow the advice. If they don't understand the advice in any way, then please sort of reach out and ask us. I know some people are going to be a lot more nervous than others about what's coming, but please just as Becky said, we wouldn't be doing this if we thought we were putting the population at a huge risk. So if you're concerned, if you're worried, if you don't understand the guidance, then please get a hold of us and we'll try and answer your questions.
So yeah, I was just going to say it's kind of not related to your question directly, but I think one of the things that we may see after quarantine restrictions are relaxed is that 2 to 3 weeks later we might start to see staff absences creep up both within government and within the private sector. So I think using the time we have now, the 6-7 weeks before that happens, to make sure that our business continuity plans are in place and that we're planning for that eventuality, I think is really important. And I stress that it's not just about government services and our essential services, but it's across the whole of the Falkland Islands. I think we need to use the time wisely so that we plan for an eventuality where we may see staff absences rise.
And will help be given to the private sector to help cover sort of eventualities where they might have large numbers of staff absent because of COVID?
Well, certainly we're looking at putting in place some support measures. But of course, we don't have people ourselves to lend to the private sector if they do run short. So I think that planning and making sure that companies and the private sector are as resilient as possible is really important.
What has motivated this decision to lift the restrictions now? Has it been economical, health, political? What's been the main motivating factor?
I can certainly talk politically about our motivations here, and I think Becky would probably want to add, and Becky and Tom maybe their position. But for us, I think we've said all along that we don't want to restrict people's civil liberties for any longer than we deem absolutely necessary. So we've been essentially weighing up civil liberties versus public health. They're the two really key issues for me, and we are reassured now. We're told that we're in the best place we could ever be, certainly have ever been so far, to be able to lift these restrictions. So I think it would be wrong of us not to have done it now. It is we cannot restrict people's civil liberties under the Constitution for any longer than is absolutely necessary.
I think the only thing I'd add as well is, from an outsider who hasn't been necessarily part of it all the time, you may see actually this is a sudden decision, but the decisions have been reviewed for the last 2 years on a fairly regular basis, and with the strategic pandemic management group meeting on a fortnightly basis, projecting out, looking at what the rest of the globe is doing as well, but what lessons we can learn. I think I mentioned in our last interview that we've been incredibly fortunate in a relative manner to be able to look to the rest of the world to see what good looks like and tailor a response to the Falkland Islands. And it's now that we believe that the Falkland Islands are indeed the strongest position that we ever will likely be in order to take that next step.
I think for me, if I was to step into the Attorney General's shoes just for 1 minute, he would absolutely reinforce the comments that Mark has just made, about that balance between civil liberties, what the Constitution says, and the public health position that we find ourselves in. And I think it's absolutely right, as we've gone through our pandemic journey, the public health advice has changed because it's a dynamic situation, it's a changing situation. And I think, as Mark said earlier, I think we do owe a debt of gratitude to Becky and her team because they have kept us as up to date as possible so that we can respond to the circumstances that we've found ourselves in throughout the life of the pandemic in the Falkland Islands.
And I guess, as you mentioned there, Tom, we have been quite beneficial in the fact we have been protected from COVID, so we can watch how other countries are responding to the pandemic and sort of take the best bits from what is working. And it's obviously clear to see that the response so far in the Falklands has worked excellently in keeping COVID out. Just finally, are lifting restrictions for the Falkland Islands now, is this the right step for the Falklands, and why?
I'll speak to this and then let the others answer in turn. I think what's really important is we've carefully looked at the public health evidence from around the world and taken advice from the UK, from our UK HSA and public health colleagues in the UK. We wouldn't, as I keep saying, we wouldn't have been suggesting this if we didn't feel that it was a proportionate and reasonable step to take. Is it going to be completely smooth? No. Are we going to see disruption to services? Absolutely, as we all get COVID. Are people going to be cursing me for saying, let's get COVID over and done with? Almost certainly, as we all have our COVID and feel pretty rotten. I should imagine there'll be a lot of people who'll be a bit fed up about the fact they've got a bit of a flu. But actually, we have to learn to live with it. Being very realistic, we can't pull up the drawbridge forever in the Falklands. That's just not possible. As I said at the beginning of this interview, wouldn't it be great if we could hide away down here until COVID just disappears? But that's not going to happen. So we need to learn to live with it. The only way we can learn to live with it is to get through it, and get out the other side. It's not going to be an easy road over the next 3 or 4 months. I should imagine it's going to be a bit bumpy at times. Services will be disrupted. We might see limited services in the hospital because all our staff become unwell. We just have to take it as it comes, and we may give different advice. We may have to amend our advice. We're going to treat this as we've treated every part of the pandemic so far, reviewing things regularly, being very careful, and providing advice where necessary.
Can I just sort of add? Tom had a really great point a minute ago about the fact that we have been constantly reviewing things, and personally I feel like I've been immersed in COVID sort of 19 world for the last 2 years, and I think perhaps it's slightly easy for us to perhaps not communicate exactly how much we have been doing, how much we've been looking at. So you know, I would just reinforce the fact that this is not a knee-jerk reaction. It's not something that we've all of a sudden just woken up one day and thought we'll get on and do this. It is absolutely based on science and evidence, and you know, the best advice we can get. And I'm very confident with the team we have here locally, as well as those who have been supporting us from overseas as well. So you know, again, I said before, some people are going to be fairly worried about this decision, and some people are not going to understand exactly what that means to them and how they go about certain things. So please don't sit at home worried. You know, reach out and let us know, and we'll try and reassure you and answer the questions that you have.
I think the only thing that I would add to that is, you mentioned taking the next step, and is it the right one? And absolutely, I'd echo everything that's been said throughout this, and we wouldn't want to take the step unless we absolutely thought it was proportionate and reasonable. But looking forward to that next step, what does it bring? It brings the opportunity for us to bring in services that have otherwise not visited the island for a long time, particularly within our space, within health and social services. It means that some of those long-awaited operations and procedures that just haven't been possible because of COVID can potentially now be programmed back in. So the end of this year looks like it could be a lot more bright than it perhaps otherwise would be.
I think that's absolutely right, and I'm really sorry that I'm the last person to speak, because everything that kind of can be said about this has already been said. But I just re-emphasise the point really, that I can understand that people will feel nervous about this, but our community have done so well so far, and they have, you know, we have this huge vaccine immunity, which is so high. So if we were ever going to take this step, I think now's the time to do it.